Opal really is our first device, right? So our aim is to get into cities and really change the way we interact with disease prevention as well as just getting communities together to stop the spread of diseases. Opal, I think, is our first step on that. Opal is a small device. It sits right beside your faucet and it encourages you to wash your hand for at least 20 seconds. But what we are really like going for is, okay, so what's that next generation of health communication, right? What are the types of content that we can put on there to encourage people to wash their hands properly? We can encourage them to then change other behaviors. Take, for example, you have a hospital, right? You know people are meant to wash their hands. You can actually show some content for them to wash their hands properly. But more than that, you can show content that actually teaches them about other things within the hospital spaces, how to dispose of needles properly, how to make sure if there's an emergency, who they should reach out to. So we are looking at it as one, we want to actually engage people while they wash their hands, but two, we want to get to that next generation of communication about health within different spaces. But on the back end of what Opal is, it's really a platform too, because we're going to be collecting data on how long people stay in front of our faucets, how long they engage with our content to inform on the different things and metrics that can reduce as a result of improving hand washing practices. So that's really what Opal is, as like a physical hardware device and a software platform that brings those two things together to make our community safer.